So, how do you get an amazing natural result like this? This young woman shows up to my office and says, I really need to feel more energetic. I do everything by myself, I work, I do everything like I've always have. However, I feel like my outside has kind of let me down. I think my eyes make me look tired and I'm just looking to feel a little bit more refreshed. However, her main concerns are that she really does want to look like herself. So here she is on frontal view before surgery. This is her consultation photograph. Here are her photographs of her right side on 3/4 view as well as lateral view. And here are her photographs of her left side on 3/4 view and lateral view. So basically she has a lot of aging at the top 1/3 of her face. I think she's got good brow position, but she has a little bit of laxity of the upper eyelid skin. She's got a lot of laxity of this entire region right here with the entire mid-face having fallen, and a lot of laxity in the neck. And these are the main target areas that we are going to try and address. So this is our surgical game plan that we came up with. I love to use local anesthesia with oral sedation, and this was the surgical game plan and anesthetic plan that was used for this patient. On this patient, we did an upper blepharoplasty, deep plane mid-face and facelift, deep plane neck lift. We did some fat transfer to her face, including the temporal hollows, the mid-face, lower eyelid tear trough, and along the jawline, as well as a full facial stem cell treatment. Here is her immediate postoperative result on the table, and you can see the result in her neckline and jawline immediately on the table. Moving along on her journey, you can see her immediate post-op. Here is her one-day post-op after her dressings have been removed. She already looks more youthful with this fat pad moved up and elevated, sharper jawline, more open, alert eyes, as well as a nice contoured neckline. Here she has her 1 week post-op, and you can see that a lot of the swelling has come down. The incision is still a little bit pink at this time, but she looks much more alert and she's actually able to go back to work. And here are her before as well as her final results. On frontal view, you can see she looks more alert, but still looks like herself. Her eyes are more open. The fat pad of her midface is nicely elevated over the cheek region. She has a sharp jawline. Here is her 3/4 view. You can again see the elevation of the fat pad with the nice volume on the midface, with the definition along the jawline and the neck. And here is that beautiful neckline that she has with a nice contoured neck without any excessive tissue. And all of this gives you that result, that beautiful smile. The main key to achieving consistent natural results is very, very accurate surgical planning, very accurate surgical execution, and modification of all these techniques to not only give appropriate results, but give those results in a natural fashion with minimal risks, as well as a very rapid recovery. Some of the things that I think that we do in order to achieve this, first of all, is our technique for local anesthesia. What I really see with these patients who are undergoing local anesthesia is that they're able to get back to normal much quicker. And a lot of the other things that also contribute to this is our meticulous surgical technique. So a lot of the techniques that we use intraoperatively in our deep plane and subsmash dissections, as well as a combination of the anesthesia for this and the surgical dissection, really results in a very natural lift with a very natural look, as well as minimal bruising and swelling. Also, when you can produce results like this, you get testimonials like this.
Hi, I'm Sherry, and I'm a patient of Dr. Athre's. About 6 weeks ago, he did a deep plane facelift on my neck and my face, and the blepharoplasty on my eyes. I was awake. He did it under local anesthesia. I took several medications that morning. It wasn't bad. I don't remember half the day, and I didn't feel anything. So I was a little nervous before, but it wasn't bad. I would do it again. Afterwards, there was not much pain, a little discomfort, but nothing unbearable. So, and every day, every week, I see a slight difference. I still have some swelling, but not bad. I would definitely do it again. I would come to him if I needed anything else, and I would highly recommend him. Thank you.